Welcome to the North Lambton Community Health Center. We are happy to have you as a client and we look forward to meeting you. What is a community health center? We're a team of professional people. We take care of your medical needs. We promote the health of people in the community. We focus on people who face challenges to accessing care. We're nonprofit and we're run by a volunteer board of directors that are all community members. Our vision at the center is healthy people, healthy communities. And our mission is working with our communities. We provide primary health care, health promotion, and community development with a focus on people who face challenges to accessing care. The North Lambton Community Health Center has 4 primary care locations. We also have our cardiopulmonary rehab center. Our locations are Forest, West Lambton, Kettle Point, and East Lambton. Information to help serve you better. These are the forms we've had you complete. Okay, so the consent to the collection, use, and disclosure of personal health information. So this is one of the forms that you've signed, and this form is to protect you, the client, and help you understand how important it is for us to protect your personal health information as required by law. So this form states that you're giving us permission to have your personal health information here at the center. So personal health information is all your medical history, as well as your name, your address, your phone number, your health card number, even the pharmacy. That's all considered personal health information, and you're saying, yes, the health center can have that here. It also is giving the health center permission to collect, use, and disclose that information if required. So a couple examples of when we disclose your personal health information is if we referred you to a specialist. Obviously, we're going to send some of your medical information to the specialist. If we wrote a prescription for you, on that prescription is going to be your name, your phone number, your address, and the medication we've prescribed to you. So that's examples of releasing your medical information. Also understand that you did not need to sign this consent and you can withdraw it at any time in writing to the privacy officer here at the center. But know if that was the situation, you would not be able to be a client of the center. We do need your signed consent in order to care for you. General consent and statement of information practices. So this piece of paper is paper that you were given with your intake forms. We've talked about most of this just in the previous slide. On this form as well, there's the added protection piece. So I just want to let everyone know that we take confidentiality and privacy of your information very serious here at the health center. All of our staff sign a confidentiality agreement each year. We have privacy orientation and yearly training throughout the center with staff, students, and volunteers. Contacting the privacy officer. For more information about the privacy practices or to raise a concern you have with our practice, contact us. Belinda Bell is our primary care team lead at the West Lambton site, and she is our privacy officer. We've also given you the information about the Privacy Commissioner of Ontario as well. While we're on the topic of privacy, I will mention consenting to release your health information to others. If you would like to have someone else involved in your care, like a family member or spouse, then we will need you to sign a consent giving the health center permission to speak to that person about your health care. Sometimes a spouse will call into the center asking for an appointment time or information about a test. We're not going to give that information out to them unless you sign the consent giving us permission to do that. Once that consent has been signed, we will document that in your chart, so when those phone calls happen, we're able to release that information to them. And this just is one of the ways that we protect your privacy here at the center. How to delist yourself from your current provider. So if you're unsure whether you have ever signed a rostering agreement with another healthcare provider, The Ministry of Health and Long-Term Care has provided an information line for you to access information to delist yourself. So just call the Service Ontario info line that we have provided to you. Have your health card ready. Just ask them to take your name off your previous provider's list. You do not need to let them know who you've been assigned to, just to remove your name. I've heard now that it's sometimes a 5-minute call and sometimes it might take a little bit longer. So just give yourself a little bit of time when you make this phone call. We ask because we care. Collection of personal background information. So this was one of the forms that you have completed. It was the form that had all those questions on it and you just checked off the box that applied to your situation. Why do we ask these questions? By asking things like race, authenticity, and gender, we can understand who our clients are and what unique needs they have. And how will we use this information? Your doctor or nurse practitioner will use this information to help care for you. This information as well is confidential and protected by law, just like all your other healthcare information here at the center. As a patient of the health center, you have client rights as well as client responsibilities. Please review this list. As well, this information has been provided to you in your new client intake package. Okay, so this slide is about our team here at the center. So each of you will be assigned a doctor or nurse practitioner. As well, the team work together to provide you with the best possible care. So here's a list of our team members. We have our registered nurses, registered practical nurses, registered dietitians, certified diabetes educators, health promoters, community developers, housing connectors, community navigators, registered social workers, respiratory therapist, occupational therapist, physiotherapist. And just a message about our therapists for physiotherapy. If you have extended healthcare benefits with your work, you do have to see a therapist outside the clinic. Our physiotherapist is here to see clients that do not have benefits. And then we have receptionists, administrative staff, and more. Programs and services. We have many programs here at the health center to help keep you healthy and well. We have our primary care, we have our health promotion, we have our community development, chronic disease management, falls prevention, dietitian services, social worker services, active living, harm reduction, hepatitis C, housing, navigation, and Rural Circles Canada site. If any of these programs or services are of interest to you, please call the center. Get involved at the center. We have our board of directors, we have our volunteers, we have a client advisor committee. So if you're interested in volunteering at the center, please let us know. Volunteers. We love our volunteers here at the health center. Did you know that the Community Health Center has over 100 volunteers? If this is something that interests you, please let us know. There is always room for one more. Prescription renewals and booking appointments. If you need your medication renewed, please call the pharmacy first. Ask them to fax the request to the health center. If you're coming in for an appointment and needing medication renewed, please bring those containers with you. And when you call to book an appointment, you'll be given the next available appointment time with your usual doctor or nurse practitioner. And to ensure continuity of care, we do not allow switching providers. And please note that the health center is scent-free. Please do not wear any perfume or scented products when coming into the center. After hours. The Community Health Center after hours phone number is listed below. It's available on our answering machine. As well, Telehealth Ontario has a number that you can call if needed. If you go to the hospital, you'll be followed by a specialist or a hospitalist. Upon discharge, give us a call as we'd like to follow up with your care. And bring your CHC client identification card. This is a card that each of you will receive. It will have your doctor or nurse practitioner's name on it. So we ask that you just tuck this card in your wallet or keep it somewhere safe so that when you do present to the hospital, you can show them this card, and that way they're going to know who you have at the center as your doctor or nurse practitioner and where to send the report. Treatment of non-cancer pain. There are medications that are helpful for chronic pain that do not have addictive properties. Non-medical treatments for chronic pain include massage, physiotherapy, traditional healing, chiropractic care, and exercise. We follow national guidelines to limit narcotic prescriptions to short periods of time after certain surgeries or trauma, cancer pain, other serious conditions. When new clients come into the center and are taking medications that are considered a narcotic or controlled substance, you will have a conversation with your practitioner as to why you're on these medications. A copy of our policy in regards to prescribing these medications was included with your intake papers. If you have any questions about our policy, please speak to your doctor or nurse practitioner. And how to provide feedback. We love to hear from you in writing, online, or in person. If you need assistance, please ask a receptionist. Okay, so that's the end of your presentation. If you have any questions, please contact the center. Our numbers are listed here below. As well, our website, there's lots of great information there, so check that out. As well, we have our Facebook and Instagram pages, so like and follow us if you're on those social media sites. And then once again, welcome to the North Lambton Community Health Center. We are so glad you're here.